Tonight, U.S. Defense Secretary Lloyd Austin remains hospitalized at Walter Reed National Military Medical Center. The Pentagon says Austin entered the intensive care unit on January the 1st with severe pain after having what he called an elective medical procedure on December 22nd. Well, turns out that procedure was prostate cancer surgery, and the Pentagon says it was, quote, minimally invasive. With more, we are joined by our medical roundup. For our medical roundup, by board certified ER Dr. Michael Daignauilt. Doctor, good to see you. You take issue with the fact that they called this minimally invasive. Why?
Yeah, I was really surprised coming from Walter Reed Hospital. This is not a minimally invasive surgery. This is a major cancer surgery. And I think because most of these surgeries are done robotically with multiple incision sites, that it gives the illusion that it's minimally invasive. But this is a major surgery. There's a risk for bleeding. There's a risk for infection, as the defense secretary found out. With that collection of fluid that was infected, it had to be drained. And so you have high risk of infection in the kidneys or in the urinary tract or the bladder. So certainly not a minimally invasive surgery.
Well, the prognosis, according to them, is that it is excellent. So that's good news. We'll see if that's true. Right. Now, prostate cancer, one of the most common in men. So for men who are watching tonight and women who can help encourage them in terms of screening and prevention, what can you tell them?
You know, as we talked about last week on here, what people could do with the new year to be more healthy. And so this is the time to talk to your family members, see who had a risk factor or who died of cancer in the family, talk to your primary care doctor, see what your risk factor is. So prostate cancer is the second most common cause of cancer death in men. So what I want our viewers to take home is that for the average male, 50 years old, that's when you want to start doing the annual screening test. It's a PSA, it's a simple blood test. If you're African American, if you have a first-degree relative who had cancer, so a father or a brother, your risk factor goes up. You should start testing at 45. If you have two or more relatives, then you have to start testing at 40. So the good news is this is a very slow-growing cancer. If it's caught early, then you can have surgery, you can go on to live a very good life. And so it's all about that early screening and prevention.
Okay, and so the great survival rate. That's great.
Exactly.
Okay. Also sad news that we got yesterday. 42-year-old actor Adon Canto, last known for his role on Fox, The Cleaning Lady. There he is. He died of appendix cancer. This is really rare. Should we be concerned? Because apparently cancers like this are on the rise. What should we know?
So we go from, you know, the second most common cause of cancer death to something like this, which is, like you mentioned, extremely rare. So just to give our viewers an idea, so it affects 1 to 2 out of every million. So very rare. 1 out of every 3 are under 50. Such as this young guy, and unfortunately that number, as you mentioned, of those under 50 who are being diagnosed with appendiceal cancer is going up. So because it's so rare, as we discussed earlier, you and I, there's not a lot of research, there isn't a screening test. This is usually people who present with, you know, right lower quadrant abdominal pain, bloating, you know, pain that just doesn't seem to go away, that lasts a long time. So again, another good reason to follow up with your primary care doctor. Don't let these things go on. If you can't see your primary care doctor, come to the ER, in which case you'd probably get a CAT scan. And this is how often appendiceal cancer is diagnosed. People come to the ER with abdominal pain, they get a CAT scan. It's a very good test. We will pick it up. We're trying to rule out appendicitis, but this is appendiceal cancer. This just means the appendix cells just go haywire. And in this case, I think what happened is it wasn't caught early on, and there was probably a significant amount of spread throughout the peritoneum and the abdominal cavity, such that surgery alone wasn't an option.
Well, you got to listen to your body. Yep.
Absolutely.
Okay, Dr. Michael Daignauilt, thank you so much.
Thank you.
All right.